My name's Jason Bacharach, and I'm the Medical Director of North Bay Eye Associates. We're a multi-subspecialty practice in Sonoma County, California, and we do a significant amount of general ophthalmology as well as subspecialty care. In general, we do about 40 YAG capsulotomies a month, approximately the same number of selective laser trabeculoplasties, and then an assortment of between 10 and 20 other laser procedures such as iridotomies and retinal laser. When we look at selective laser trabeculoplasty and break down in our practice how we use it, about 10 to 20% of the lasers are done as primary therapy now. That is, the patient's never been on medical therapy and choose laser treatment as their initial choice of glaucoma management or ocular hypertension management. Approximately 60% of the patients are either adjunctively being treated with the laser to adjunct medical therapy, or they're repeat treatments. And that would comprise about 60% of the lasers that we do. The additional 20% are people that are either taking medications and can't tolerate the medicines, or they can't afford the medicines, or for whatever reason the medication wasn't working. And that 20% of individuals I would consider to be in the replacement component. I think that the technology in particular with the SLT has demonstrated itself to be very beneficial, as stated earlier, for our practice in terms of return on investment, as well as for our patients, most important. I would say that the SLT laser has revolutionized the way we manage glaucoma patients. When I look at where laser was positioned before the SLT laser, when I used the old argon, for example, we really looked at it as a stopgap measure between medicinal therapy and surgical therapy. And in many patients, patients had been treated for many years with medications. And the laser I found to be very non-efficacious, and many of those people went on to incisional surgical management of their glaucoma. With the selective laser trabeculoplasty, we've advanced or moved forward the SLT into our treatment cascade at a much earlier position. And what I mean by that is, in many cases, with no medicine as primary therapy, or in most cases after one medicine, we've initiated SLT therapy for the patient. We found that that's been beneficial in many ways. It's reduced the number of medicines that patients have had to use. It's been cost effective for patients, reducing their pharmacy outlay, their cash pharmacy outlay or benefits on their insurance, and in many cases has avoided incisional surgery as well. So again, I believe that SLT laser has really revolutionized how we treat glaucoma patients. In terms of the laser itself, I believe that it's a state-of-the-art laser that has provided excellent efficacy for treatment. And again, the ROI, or return on investment, for us as clinicians as well as for our patients has been extremely positive. Well, I think what I liked most about the laser was the efficacy as well as the gentleness of the procedure. And when I talk about gentleness, this laser does not produce PAS when it's aimed in the angle or peripheral anterior synechii. It does not change the intrinsic architecture of the meshwork, and I believe that's why it's repeatable. In addition to the excellent gentleness of the laser, I believe that it's demonstrated excellent efficacy for our patients. And if you look at Katz et al.'s article, where patients have demonstrated at least a 20% reduction in intraocular pressure off the baseline within 2 weeks, our clinical experience mirrors that. So we have a gentle, efficacious procedure that has an excellent safety profile. We've been using the laser now for almost a decade in the practice, well over 3,000 treatments, and we've had no serious adverse events with the utilization of the laser. Other benefits of the SLT laser would include its patient friendliness. And what I mean by that is the patients don't need a driver to bring them into the office for the procedure. A few drops are administered prior to the laser to make sure that we don't have a pressure spike, as well as some topical anesthesia. After the laser, many of the patients say, that's it. It's a very pain-free laser. And afterwards, many doctors choose to utilize nothing for their postoperative regimen. We do place the patient on a nonsteroidal anti-inflammatory drop for BID usage for 3 or 4 days. In addition, many of the patients are able to reduce the number of chronic medicines they use. So I think patient friendliness is very important. In addition to that, I think it's a practice builder. The best way to build a practice for a young glaucoma specialist or general ophthalmologist is surely by word of mouth. And this laser did that for our practice. Patients would go into the communities and talk to their friends about the procedure that they had done and how they were able to either diminish the number of medicines, in some cases avoid incisional surgery, and this surely is something that leads to other patients coming to your practice looking for treatment options. In terms of repeatability of the laser, I think that that's a very important aspect of the technology. In fact, we looked at repeatability and presented that data at the Barcan Society meeting here in San Francisco with the collaboration of the residents where I teach at California Pacific Medical Center. And our clinical experience was very similar to what was reported by Hong et al. In the Journal of Glaucoma. And that is, in at least 80% of people that had success with their initial treatment, that they would at least get an additional 20% reduction in intraocular pressure with a second treatment. We now have had the laser long enough that many patients have had third and fourth treatments, and it has demonstrated efficacy in those patients as well, avoiding the long-term use of medicines, or at least diminishing the frequency and volume of medicines applied to the front surface of the eye. So from my standpoint, the repeatability is incredibly important, and from my patient standpoint, it's probably even more important. So yes, I believe repeatability is an incredibly important factor for most clinicians managing glaucoma and considering this technology in their practice. In addition to the actual technology, the two other important components that are important are service and what I would call add-on value. Looking at service, the SLT has actually rarely had a problem in our practice and rarely gone down. But in the few times that we have needed service, Luminous has really functioned like Coherent before them, and Coherent has become Luminous very efficiently. We've either had replacement parts or replacement laser delivered to our office, diminishing downtime and in some cases saving our day. One of the important things about using the Luminous SLT laser are the important relationships and add-on value that Luminous brought to our practice. Educational material, not only for our patients in the form of videos on the patient portal, but also for our physicians in terms of CME events, both nationally and locally, as well as information transmitted through their excellent representatives that service our practice. Finally, the add-on service really is what I would consider education for patients, education for our clinicians, including myself, and the relationships that we've developed with Luminous. We really look at it as a partnership in healthcare delivery. My relationship working with Luminous, and it's almost a decade now, and again working with Coherent before them, has demonstrated itself really to be a collaborative effort. I truly believe the people within the Luminous organization, whether it's on the R&D side or whether it's on the sales force side, care about their clients, that being the physicians, and really care about making sure that the technology that's acquired is implemented in a very positive way. The relationship only begins when the purchase or lease of the laser is consummated. And I believe that's very important to me and very important to my colleagues. In terms of obstacles for acquiring SLT technology in our practice, there really was none. We did our homework. We discussed it with the business people within our organization. I discussed it with my colleagues within my practice. We reviewed the peer-reviewed literature that was available, and there surely is a lot of peer-reviewed literature available now on the laser, as well as CME literature that's available on the laser. We also looked at our utilization rates of laser trabeculoplasty, and I believe we were able to identify that that could be significantly improved. And we looked at what our patients were interested in. And after formulating this information, there was no obstacles. The only final issue, and we discussed this with Luminous personnel, was the way that we were going to acquire the laser, whether we were going to lease it or buy it. We ended up buying the laser with an excellent package that Luminous Financing put together for us. As a result of buying the SLT, I think we found just what we expected. We found a laser that provided excellent efficacy. J. Katz et al. Published a study that showed a 20% reduction in intraocular pressure within 2 weeks of people being treated with pressures greater than 21, and our clinical experience mirrored that. So an excellently efficacious laser for lowering pressure. We found, as we expected, an increased utilization of the laser, not only because of its repeatability, but also in patients with light pigmentation in the angle, where an argon laser or diode laser would never have been considered. We consider this laser. And finally, and very importantly, we've acquired a laser that's very durable and something that we can rely on to function regularly. Well, if somebody was interested in acquiring the laser, I would suggest to them, number one, to do their homework. And that homework would include looking at peer-reviewed literature, discussing the laser with doctors that have already implemented it in their practice and get their clinical experience, and also, of course, and I think just as important, speaking to our friends at Luminous, who will help guide them and make sure that their results are excellent. I look at Luminous both on the research and development side as well as on the sales side as partners, and a wraparound with myself, with the patient in the center. And I really believe that. I know many people at Luminous now. I've been to their research and development lab in Utah, and I believe that these are excellent scientists, clinicians, and salespeople that really care about the success of the laser in clinical practice. And I believe that what my colleagues will find after they look at the data and after they have the appropriate conversations, they'll find just what we did, that the laser was incredibly beneficial, not only for the clinical aspects and the excellent efficacy that it's demonstrated, but also for return on investment. And when I say ROI, I mean not only for us as a practice and small business, but also for our patients and cost savings, again, for pharmaceutical products. So I think for us, the proof is in the pudding. We now have 3 Luminous lasers in our practice, and I believe my friends and colleagues, after they do their homework, will find the same thing.